Good afternoon, and thank you for joining our town hall today for our women's heroes that we service. My name's James Doling, and I'm the hospital director here at Edward Hines Jr. VA Hospital. We have a packed agenda, a lot of great information for our female heroes, and we're showing the agenda now. I'd just like to say a few words to kick us off. So our Hines VA Women's Health Program continues to focus on expanding their reach to share information widely with women veterans about programming and services available to Hines veterans. To increase visibility and strengthen our community partnerships, the Hines Women's Health Program partnered with Jesse Brown and hosted a women veteran stand down at Malcolm X College. The event was a huge success and featured VA and community resources, whole health activities, personal development, massages, and much more. Thankfully, we were able to attract over 150 female veterans. Team Hines is planning to host another similar event in the future, so please watch for more details. Additionally, we recently had a Hines drive-through baby shower. Also a big success. Expectant veteran families received essential items to welcome their new babies, and we had over 30 veteran families that were served at this year's event. Our Women's Health Program has a new Women's Health Champion, Ms. Annette Wilson, who is here today to tell us more about her role. We are also waiting for our new Women's Veteran Program Manager, and she should be arriving soon. I'd also like to take this moment to highlight an important health initiative, the October Health Campaign on Breast Health. The goal of this campaign is to encourage women veterans to speak with their healthcare team to assess their risk for breast cancer. Additionally, the campaign will focus on the Dr. Kate Hendricks Thomas supporting expanded review for veterans in combat environment. This is an act that allows any veteran who served during specified periods of time in certain combat locations to receive breast cancer risk assessment and get a mammogram if a risk is found. Kristen Richter is here today, and she'll be discussing this act further. And if you have any questions or concerns, I encourage you to talk with your primary care provider. October is also Domestic Violence Awareness Month, and Erin Hanrahan from our Intimate Partner Violence Assist Program will be here to discuss this. We have a great lineup, as I said earlier, of people to share information about the services and resources available for our women veterans. We're celebrating 100 years of medical care for our female heroes. Next, I'd like to introduce our Acting Chief of Staff, Dr. Haxton, who will talk about vaccination updates. Dr. Haxton.
Thank you, Mr. Doling. Good afternoon. I'm John Haxton. I'm the Acting Chief of Staff this week. I'm also the Dental Service Chief here at Hines. And I have a couple of updates as far as vaccinations go. Flu shots. Flu shots are available at our main hospital, outpatient clinics, and CBOC locations from 8 a.m. to 3:30 p.m. No appointment is necessary, and the best time to receive your flu shot is now, so please don't delay. If you have any further questions about it, please contact your primary care provider. Our COVID-19 booster vaccinations. COVID-19 cases continue to rise across the nation. Cook County alone has seen over a 15% increase in COVID-related hospitalizations over the last week alone. Please exercise caution and mitigate risk when possible to help limit the infection's spread. Hines expects to receive COVID-19 boosters soon. However, initial doses will be limited to high-risk patients until more can be delivered. Please continue to check our social media channels for updates. A couple more announcements on that. I am aware that the vaccination will be Pfizer, and as stated, I just stated it's only available to a special selection of veterans at first because of the limited supply that is available, but orders will be placed on a weekly basis. And next to present comments on the Service Act is Kristen Richter.
Hi, good afternoon. My name is Kristen Richter. I'm the Women's Health Program Clinical Coordinator, and I'm going to be talking about the Dr. Kate Hendricks Thomas Supporting Expanded Review for Veterans in Combat Environments Act, also known as the Service Act. So the Service Act is a new law that extends access to breast cancer risk assessments and screening mammograms to veterans who served in certain combat locations and had a toxic exposure. So at the VA, we typically would start breast cancer screening for women at average risk for breast cancer at age 40. And the Service Act expands eligibility to women who are under age 40 if they served in certain combat locations and had a toxic exposure. And it was named after Dr. Kate Hendricks Thomas. She was a Marine veteran and public health professional who served in Iraq and was exposed to burn pits. She was diagnosed with breast cancer in 2018 and then passed away at the age of 42 in 2022. So some sort of important considerations about the Service Act. At this time, there's no direct link that's been found between toxic exposure and breast cancer, but VA is concerned about individual reports, and research is ongoing to find out if toxic exposure may be a cause of breast cancer. So it's important to talk with your provider to determine your risk level, discuss the risks and benefits of screening, and also talk about your preferences before deciding to proceed with a mammogram if you're under age 40. And how to do the breast cancer risk assessment. So eligible veterans can schedule a breast cancer risk assessment with their primary care provider or with me, Kristen Richter, the Women's Health Program Clinical Coordinator. There's my number up on the screen, and you can contact me to schedule a phone visit, and we can go through the breast cancer risk assessment. There's no charge if the risk assessment is the only reason for your visit or if it's done via a telephone visit. So during the risk assessment, the provider will review your personal and family history and exposure to toxic substances while serving. And then after the breast cancer risk assessment is completed, if you've had a toxic exposure, the next steps will vary based on your age and preferences. We typically don't recommend mammograms to women under 30 because they have higher breast density, which can lead to false positives and unnecessary testing. If you're between the ages of 30 to 39, you want to discuss the risks and benefits of screening mammography with your provider. And then if a mammogram is indicated, the provider will place a community care mammogram referral. And then if you're over age 40, you're already eligible for routine screening. And then women with an elevated risk due to a personal or family history can also be referred to genetics and the high-risk breast clinic. So if you have a mammogram completed through the Service Act and it's normal, the recommendation is to rescreen every 5 years until age 40, at which point you could begin yearly mammograms. And then if the mammogram is abnormal, the VA would pay for any follow-up care for any enrolled veterans. If breast changes or concerns occur between screening mammograms, it's always important to notify your primary care provider about that. So thank you very much. And next up, we have Tijuana Grooms talking about women's reproductive health. Thank you.
Good afternoon. My name is Tijuana Grooms, and I am one of the providers here in the gynae clinic at Hines VA. Along with myself, there are two other doctors in the gynae clinic that are general gynecologists, and we also have a urogyne doctor there. Today I'm going to update you on our reproductive health services, what's new at the VA. Okay. All right. Okay, so first of all, I want to say that that what's new as a service in the reproductive health area, the Department of Veteran Affairs has amended its regulations to remove the exclusion on abortion counseling from the medical benefits package. Abortion counseling is now included as a component of pregnancy options counseling provided by the VA staff and clinicians. As of right now, the VA provides menopausal care, fertility services, including infertility workup and IVF treatment in certain situations, in patients that qualify, contraceptives, emergency contraception, maternity care, including life-saving treatment related to pregnancies, such as medical necessity for care for veterans presenting with ectopic pregnancies and miscarriage. So what that means, if we do, one of our vets does have a miscarriage or ectopic pregnancies, we do have the means to refer them out for community care for care. okay? As well as abortion services, as I mentioned earlier. All VA providers can provide our veterans with the following. So when I say all VA providers, I mean your primary care doctor, your women's health care provider, and of course the gynae providers. Pregnancy options counseling, referrals for social work, referrals to psychologists, referrals for gynae services within the VA, referrals for reproductive service in the community, and referrals for maternity care in the community. And when we say in the community, that means as of right now, none of our CBOCs or our Hines has those services, but we're able to refer you out for them. And that's it. Now, up next, we'll have our pharmacist, Nick Super.
All right, hi everyone. My name is Nick Super. I'm the Doctor of Pharmacy, the clinical pharmacist here in the Women's Health Clinic at Hines VA. And I'm going to be very brief today, just a brief update on pharmacy services because we have so many exciting things to cover. For starters, I wanted to let you know that Hines Pharmacy, the outpatient pharmacy here, is fully equipped to meet the full spectrum of needs that arise for women in primary care clinic, and women's health needs in general, as Tawana alluded to there. So both commonly and uncommonly encountered conditions, we have all the medications you need here at Hines Pharmacy. And a quick tip about the pharmacy, this comes up fairly often as far as refills go. How to get a timely refill. There's no absolute foolproof method, but the best way to get a timely refill is to call in your refill as soon as you receive one in the mail. So when you get your meat refill in the mail that same day, call in the next one. It will prompt the computer system to send the next refill when it's due. So that's the surest way to get your refill on time. And of course, if you have trouble getting that refill, please reach out to our pharmacy here. And I wanted to give you another quick tip about pharmacy services right now. You've probably heard in the news about national shortages on weight loss medications like Ozempic and Wegovy is another one. These do persist. We have intermittent stocks of these medications, and if you do take one of these medications, please be in touch with your provider about our stocks and availabilities. So far, we've been able to keep up more or less with these, but it does change day to day, week to week, so please be in touch with us about that. And as soon as they're more steadily available, hopefully the problem should resolve. And then an update on what pharmacists can do for you in the clinics. So each of our primary care clinics here at Hines and at the CBOCs has an embedded clinical pharmacist like myself who can help you manage diabetes, high blood pressure, high cholesterol, lung conditions, and other conditions as well. And as the women's health pharmacist, I'm equipped to help you with issues like contraception or birth control, management of medications in pregnancy, menopausal symptoms. I'm available for face-to-face, virtual visits as well. If you're interested in speaking with a pharmacist about any of these issues, please speak to your provider for a referral, and we're happy to see you in clinic and happy to help you stay healthy as we can. With that, I'll pass the baton along to Dr. Lizette Rodriguez-Cabezas to talk about women's mental health services. Thanks so much. Oops. There we go.
Thank you so much for that introduction. My name is Lisette Rodriguez-Cabezas. I'm the Women's Mental Health Medical Director, and I'm here to talk to you about women's mental health. So the types of programming that we offer are a variety of different services. We have many different mental health experts in place in multiple different clinics and programs throughout Hines that specialize in caring for our women veterans. We have specialists like psychiatrists, psychologists, social workers, nurses, and peers that are have special training in working with women, veterans, and women regarding reproductive mental health, regarding substance use treatment, women that might have a history of trauma, women that might have issues with sleep, with pain, and there's also specialists that are embedded in the primary care clinics. They are under the umbrella of primary care behavioral health as well. And then we have a variety of different women veteran focus groups that are both peer-led and provider-led. So just to give some examples of the different groups that are being offered, there's Comfort and Courageous. There's a crafted wellness group that is in the works right now that incorporates community-based organizations, recovery, and community integration. There are a few different peer support led groups, the Women's MST group, a Women with Disability Support group, a Perinatal Depression Prevention group that is known as ROSE, and a STARE, which stands for Skills Training in Affective and Interpersonal Regulation, which is based on working with women veterans who have a history of trauma, and it's skills focused. And then there's Superwomen Revamped. Another thing that we wanted to make sure that our women veterans are aware of is the opportunity to give us feedback on what else we can do to help meet the needs of women veterans. So this is known as the Women's Mental Health Advisory Board. It's made up of both staff and veteran members. So as a veteran member, women would have the opportunity to attend quarterly meetings and play a key role in shaping and improving care for other women veterans at Hines. So basically, you have the opportunity to tell us what's going well, what's not, what you feel like we could still offer that's not currently in place. And it's really a women veterans opportunity to give us feedback on what we can improve or what they would like to see. If you're interested in being a part of that Women Mental Health Advisory Board, please reach out to Dr. Kate Colangelo at the number provided, and we'd be happy to have you join us. So that's the summary on what's going on lately in women's mental health. I'm going to pass the baton over to Dr. Annette Wilson, who will talk to you a little bit more about the primary care behavioral health aspect of the mental health that I mentioned earlier.
Hi, my name is Annette Wilson. I am a psychologist with primary care behavioral health. So the first thing I want to just clarify, so at the Hines VA, we call it primary care behavioral health. At other VAs, maybe you've been to other locations, it is called primary care mental health integration. It is the same thing. At Hines, we call it PCBH. At other locations, it's called PCMHI. So PCBH and women's health, we're population-based care and proactive. So we want to try to reach as many women veterans as we can, and we're part of your primary care team. So collaboration, consultation, and we're part of that team. So we provide same-day access and warm handoffs, and that can happen in a number of different ways. Through the screeners, that when you check in for your appointments, you're asked, have you lost interest in things? Are you feeling down or depressed? That is, a way that we are alerted that someone might be interested in talking to a mental health provider. We also work with the team that because we collaborate and work so closely, that I've had providers say, I just met with so-and-so and she said she's doing okay, but she doesn't seem like herself. Maybe can you go check in on her and just see how she's doing? And so that's really, we want to provide that same day access. So while you're already at your primary care appointment, that we have behavioral health available to you. Another big part of it is facilitating transitions across the step care continuum. So at the Hines VA, we have a lot of services that we offer. And so you can see kind of at the bottom, primary care, mental health integration. We want to try to catch the most people that we can and try to catch symptoms while they're mild to moderate and hopefully prevent them from turning more severe. And so there are a lot of services, and we help facilitate moving to different, specialty mental health, reproductive mental health, depending on what's going on. So what do? We provide, brief assessments, some psychotherapy. This can be for some depression, grief, a lot of stress management that sometimes the beginning of the school year is a stressful time. So we can do some assessments. We're measurement based, and so we track different, depression scores or anxiety scores throughout to track progress. We also have collaborative care management and psychiatry consultation. And so what that is, it's a team of nurses. And so if you're starting a new medication for mental health or maybe transitioning from one to the other, we have a team of nurses who you can work with, who help talk about side effects, or maybe you have some upset stomach, maybe take it with a full stomach or on an empty stomach. They can kind of give you some tips on when you're transitioning on a medication. And then we also have peer support. So with PCBH, we have 3 peer support specialists, and 2 of them are women veterans. So we're very blessed to have them. We also have a lot of different groups. They're, based on wellness and self-management. And so we have, different things for stress and sleep, pain management. We have a wellness workshop that targets different things. And then also some specialty services, CPAP tolerance class, if that's something that you're starting. And we also have, for chronic insomnia and chronic pain, if some of the other groups weren't as effective. And so one thing I want to highlight is we have a Superwoman revamped, and this group is about kind of identity of a strong Black woman, and we are starting a new cohort. So we're recruiting for our October cohort, and so if you are interested, you can tell your primary care physician. If you're in the women's health clinic, you can tell me. Amanda Long is the psychologist who is in charge of that group, but we would love to have you in the October cohort. And so next we have Dr. Pereira here for the she's our MST coordinator.
Hi, I'm Dr. Pereira. I am the Military Sexual Trauma Coordinator, and I want to take a few minutes to give you some information about MST. Military sexual trauma is sexual assault and sexual harassment that happen during military service. And based on our estimates, which are likely to be imperfect, about 1 in 3 women and 1 in 50 men have reported experiences of MST to their care providers at the VA. The impact of MST can be wide-ranging. Survivors may be struggling with a number of medical and mental health concerns like PTSD, substance abuse, sexual dysfunction, chronic pain. And if you are impacted by MST, please know that at Hines and at various CBOCs, we have clinicians, medical and mental health clinicians, knowledgeable about MST, ready with treatments that can give you some relief and improve your quality of life. We also have MST specific groups. The women's MST group is an example of that, where veterans can talk about the impact of MST and learn coping skills in a supportive community of other veterans who have who've had similar experiences. If you are interested in MST related services, please talk to your doctors, your therapist. VA is committed to offering confidential MST services for free of charge. Even if you may not qualify for VA services in general, you may still qualify for MST related services. So if you are wondering about MST specific eligibility, please do contact the Hines Eligibility Department or contact me. I realize I never forwarded the slides, so I apologize for that. We are at the very end of this. So like I said, the MST, like any other personal information about MST is safeguarded, it's private, we respect your privacy, and it is free of charge. And as I mentioned, if you are wondering about MST specific eligibility, please do reach out to me or our eligibility department. In addition to services at Hines, we also have the Beyond MST mobile application that's free of charge. You can download the app via the App Store. It's not a substitution for treatment, but it is an additional resource that's really helpful. And the icon for the application looks like the one on the slide. All right, next up we have Erin Henrahan from the Intimate Partner Violence Assistance Program. Thank you.
Good evening, women veterans. Thank you so much for being here. I'm Erin Hannerhan. I'm the Intimate Partner Violence Assistance Program Coordinator here at Hines. Our mission is to provide comprehensive programming to veterans, their caregivers and partners, and VA employees who are impacted by domestic violence. According to the Coalition Against Domestic Violence, 1 in 3 women and 1 in 4 men report experiencing intimate partner violence. According to the National Center for PTSD, it states that veteran population is twice as likely, the number is twice as likely as high. Within the Intimate Partner Violence Assistance Program, we provide education and support to identifying healthy, unhealthy, and unsafe relationships, provide safety planning, and conducting assessment and screening to identify unhealthy and abusive relationships. We provide referrals within the VA and in the community, and also provide brief counseling interventions. I'm just going to speak about a few interventions that we offer. I first want to start with RISE, which stands for Recovering from Intimate Partner Violence Through Strength and Empowerment. This is a clinical intervention, up to 8 sessions for somebody who's experiencing intimate partner violence on a variety of different topics that they choose. We also have Strength at Home for Veterans, which is a 12-week group intervention for veterans that are using anger, aggression, or violence within their intimate partner relationship. And then we last have Strength at Home for Couples. This is an 8-week intervention, and this is for couples who want to reduce conflict, improve communication skills, and improve healthy relationship skills. If you're interested in any of those clinical services, you can contact me at 708-202-7243, or you can ask one of your members of your VA care team who can make a referral. Lastly, we have learned from veterans that they believe it's important in our healthcare system to ask about relationship health and safety and improve their physical health and mental health and overall well-being. Consistent with the current VA IPVAP policy, we will begin providing annual screening to all women veterans who are 47 years of age and under. Screening will be conducted at least annually, and resources and referrals will be offered to support your health, safety, and well-being. Eventually, all veterans enrolled in the VA healthcare will be screened. In closing, October is Domestic Violence Awareness Month. Be on the lookout on our Hines webpage and on our social media for the efforts in raising awareness. We want you to know that you're not alone and help is available. So you can reach out to me again at 708-202-7243. And again, you see our National IPVAP website program for more information. Thank you so much for being here. And next, we'll hear from Suicide Prevention, Ms. Jen McNear.
Thank you, Erin. Again, my name is Jen, and I'm one of the 5 suicide prevention coordinators we have here at the Hines VA. The suicide prevention program was developed in 2007 to provide veterans, caregivers and families, communities, and VA employees with services and resources for suicide prevention. While this includes attending outreach events, providing trainings to staff and local organizations, and accepting suicide prevention coordinator consults from the Veterans Crisis Line, the suicide prevention team primarily works with veterans who are flagged at a high risk for suicide. This means that they've had a recent attempt or preparatory behavior, and we provide them with enhanced case management. September is Suicide Prevention Awareness Month, and we are reminding veterans everywhere that suicide is preventable and there is hope. Although the veteran suicide rate meaningfully decreased in both 2019 and 2020, which is the most recent data that we have, the suicide rate among veterans was 57% higher than their non-veteran counterparts. Women are the fastest growing veteran group. In 2019, they were approximately 9%, and they're expected to grow to 15% of the U.S. veteran population by 2035. In 2020, 26.8% of female veterans died by suicide via overdose or poisoning, and 48.2% died via firearms. While we've seen the largest decrease in female veteran suicides, about a 12.8% decrease, there's still more work to be done. And so the suicide prevention program offers lethal means safety items to all veterans free of charge, and these can also be mailed to your home. This includes medication lock boxes, pill boxes, medication disposal bags, and gun locks. If you're interested in any of those items, please let your VA provider know and we can coordinate getting those out to you. If you're a veteran in crisis or you're concerned about one, please contact the Veterans Crisis Line. It's available 24/7. It's confidential. You don't have to be enrolled in VA healthcare. You don't have to have VA benefits. You don't even have to be a veteran yourself. If you're concerned about one, please just reach out. That's 988. You press 1 for veterans. You can also chat online with someone at veteranscrisisline.net, or you can text them even at 838-255. Since it's Suicide Prevention Awareness Month, we wanted to conclude with a quick review of the warning signs of suicide and what to do if you encounter someone who may be suicidal. So some warnings of suicide can include withdrawing from family and friends, a change in personality, maybe they're more anxious, more irritable, more angry, difficulty in sleeping, losing interest in hobbies or work, giving away personal possessions, maybe there's some increased alcohol or drug use, engaging in risky behaviors that's unusual for them, or seeking out purchasing firearms or medications. If you encounter someone who is suicidal and you think they're in danger, please call 911 and do not leave that person alone. If they're not in immediate danger, it's okay to have that conversation. It's okay to ask the question, are you having thoughts of suicide? Let them know that you're concerned and worried about them. Maybe even call 988 together and just be available for them. As we said before, everyone plays a role in suicide prevention, and everyone can be part of the solution by checking in with the veterans in their life who may be going through a rough time and encouraging them to reach out for help. Next, we have Dr. Mayberry with closing remarks. Everyone, I never took this.
All right. Well, thank you so much for everyone coming and being here. This is actually the 100th year of VA serving women veterans. So as you can see, we are always innovating and learning. We appreciate you. Any feedback you have, any questions, we are happy to answer now. It doesn't look like we've had any questions thus far, but please, if there's one takeaway, know that we have a lot of services and a lot of resources for women veterans. So come in and ask your providers about those, get connected, share what you learned here today, because we are always trying to learn and grow and serve women's veterans and their health the best way we can. So thank you for being here, and we hope to see you at our next town hall.